In South Africa right now, some public clinics are effectively being turned into informal checkpoints. At the Diepsloot Public Clinic in Johannesburg, members of an anti-migrant group called Operation Dudula, a name that means to push out by force in Zulu, arrive before opening, stand at the gate in matching outfits, and ask people for identity documents before they even reach the reception area. If someone can't produce a South African ID or is identified as a foreign national, they are often told to either leave or seek care at a private hospital. According to health officials, civil society groups, and court documents, this has not been limited to one facility. Similar incidences have been reported at other government hospitals and clinics in Gauteng, South Africa's most populous province, where long-standing tensions over migration and access to services are increasingly playing out in the health sector. Operation Dudula frames its actions as a campaign to put South Africans first. Members argue that high unemployment, pressure on public services, and limited health resources mean citizens should be prioritized over undocumented migrants. They claim foreign nationals are contributing to overcrowded waiting rooms and shortages of beds and medication. Available data, however, paints a more complex picture. So foreign nationals make up a small minority of South Africa's overall population, and the country already dedicates a relatively high share of its GDP to health spending compared with many peers. Health policy experts and rights organizations say the system's problems are largely tied to years of underinvestment, mismanagement, and staff shortages, rather than solely to migration. The South African government has publicly stated that these gate checks are unlawful. The Constitution and the National Health Act guarantee basic health care to everyone within the country's borders, regardless of nationality or immigration status. A Johannesburg High Court has issued an order instructing Operation Dudula members to stop blocking or harassing people seeking care at public facilities. Police have also intervened in some cases, including after members entered a maternity ward in Soweto and demanded ID documents from patients. Human rights groups and medical organizations report that some migrants, including pregnant women and people living with chronic illnesses, are now avoiding clinics because they fear confrontation at the gate, raising concerns about treatment interruption and long-term health consequences for both migrants and citizens who rely on the same system. If you believe independent journalism like this matters, consider supporting the show through Patreon or a YouTube membership with added perks. For as little as $1 a month, you can help us keep telling the stories that go far beyond the headlines and bringing valuable information to the masses. We don't have big donors or sponsors. We are truly building this pure and from the ground up. If you've gotten something out of these videos, please consider becoming a supporter today and be sure to follow the show so that you don't miss any new updates.